15th district encompasses the majority of the city of Knoxville, East Knoxville, downtown, Ford, University of Tennessee, Beaumont, Mechanicsville, the most historic part of Knoxville. I like to think that my district is the most diverse, looks most like America. I have all kinds from rich to middle class to the working class, poor, African Americans, whites, blacks, Hispanics, Native Americans. So very proud of my district. To pick a piece of legislation that I want to get passed, you have to understand I'm a Democrat, part of the Fighting 25, so we have to have a lot of bills because it's kind of like Ninja Warrior. You try to just throw in there and see what you can't get passed. So one bill that I'm really working on, violence against youth is really stretching across the state of Tennessee. There's been a lot of drive-bys that have taken the lives of so many young people, especially within the inner city. We lost a young man named Jawan Latham a few years ago, so a piece of legislation I have is the Jawan Latham Act. If you are found guilty of a drive-by that ends with the death or bodily harm of a minor, increases the penalty for you if you're found guilty. So that's a piece of legislation that's personal for me, and hopefully I can get that one through the gauntlet and get that passed. And hopefully my chairman of calendar rules will put it on a consent calendar. I'm just going to pass it along.
Hi, I'm Bill Dunn, chairman of Calendar and Rules. I represent 16th District, which is Fountain City, Powell Halls, Brickey High School area. And I've got a bill that deals with teacher colleges and rewarding those who turn out effective teachers.
I'm Representative Roger Kane. I represent Northwest Knoxville, the Carnes, Hardin Valley, Farragut North, Inskip, Norwood, those kind of areas. I chair Education Subcommittee, and right now I've got a bill put together in my district. You may not even know it, but as you go through Solway, that's known as the Veterans Mile. There is a little green sign on the side of the road, and that's the extent of the Veterans Mile that we know it. I want to work with veterans groups and TDOT so that the people of this county and the veterans, because we've had a difficult time maintaining that area. TDOT cuts the grass 4 times a year. Sometimes it is very reminiscent of the fields of Vietnam because the grass grows 6 feet tall, and they have trouble cutting it because we have contracts that say 4 times a year. I would like to give each of branches of the military one of the medians to maintain, and they can turn it into the Army median and the Navy median, the Marine median. It looks so much better, especially as people are going in up the Pellissippi Parkway to Oak Ridge or coming out that area. So, but you have to actually pass an act to get that to happen. So I've got that in the works.
Good afternoon. I'm Jason Zachary. I'm District 14, which is deep West Knox County, Farragut, Concord, Bluegrass, Lots, Rock Hill, North Shore. It's great to be with you in my second term, Vice Chair of Insurance and Banking. I've got a piece of legislation that I'm going to be really passionate about this session related to the opioid crisis. Everyone is well aware that that is the crisis of our time. It is the #1 issue we face right now in Tennessee. A couple of months ago, I reached out to Chief Trammell and Chief Roush asking how can we help. If you had one piece of legislation you know that's going to pass and that would make an immediate impact, what would that be? And they both talked about updating the controlled substance database. So when doctors go in and check before they prescribe opioids, they can see if you've been convicted of drug dealing, illegal possession. And so this piece of legislation will simply require, and Dr. Briggs and I are carrying that, this piece of legislation will require the DA to submit those names within 30 days of conviction. So it's just one small step we can take to address the opioid crisis.
Thank you. I'm Becky Massey and serve in the State Senate, and along with Senator Briggs and Lieutenant Governor McNally, we serve Knox County. And so we just all work off each other's strengths to serve everybody regardless of where you live in Knox County. I serve on, just recently got appointed to the Senate Finance Committee. I'm the only one on the Finance Committee in either the House or the Senate from not only Knoxville but all the way up to Upper East Tennessee. So I was honored to be placed there last week, and then I'm still serving on the Transportation and the Health Committees. One bill that I'm going to be carrying is when an individual is arrested and is booked. if this passes, when this passes, the law enforcement will have to ask this person if they have a minor child at home. And so that the child welfare, the Department of Children's Services go in and check and make sure that that child is not with somebody that is not safe to be with, and just check on the safety of that child.
Yes, I'm Richard Briggs, and I'm the other senator after Lieutenant Governor McNally and Senator Massey in Knox County. I think the most important bill that I have this year is my organized crime retail theft bill, which we're trying to do what we can to stop the financing of the illegal opiate trade. We've been working with that with Representative Zachary. I'm also, I believe, co-sponsoring the bill, the drive-by shooting bill, and I'm the chairman of the Veterans Caucus. So we're involved in a lot of these things. But this opiate crisis is the #1 problem facing the state. And it's bigger than just a drug and a health problem. It's affecting our schools, it's affecting jobs, it's affecting workforce, it's affecting economic development. So any plans that we have on those other very important areas, the opiate problem is the monkey wrench and causes some of those to go off the track. So I think these are some very important issues that are bipartisan. They're not conservative or liberal, but something we all should be concerned about.
Good afternoon. Eddie Smith, House District 13 here in Knox County. Starts over at Easttown Mall, goes through Old North Knoxville, Inskip, Lonsdale, Sequoia Hills, Pond Gap, and then half of South Knoxville. So it kind of does a see around downtown. And the biggest bill that I'm working on this year is in dealing with recovery high schools. Right now in the state, we only have one recovery school, and it's a private school. And last year they only had one student. So when you look at it, the cost is too expensive for parents to send them to. So what we're looking at is developing a pilot program to make public recovery high schools, one in each Grand Division, working with the Department of Education and the Department of Mental Health as we develop the best practices. Because what we know is students who end up on a substance, not necessarily an opioid, of course that's the biggest issue we're all looking at, but on any substance, they let their schoolwork go. They end up dropping out of school. So we want to try and find a way to help as they're going through recovery, get them back, get them graduated, and most of them will end up, based on the research we've done, will go on to a post-secondary degree, and it can radically change their life and put them back on a better course going into adulthood. So that's the bill that we're working on this year.
Good afternoon, I'm Jimmy Matlock, and I serve Loudoun and Monroe counties, and I appreciate being invited as part of the delegation. They allow me to work with them, and I find myself in many ways like-minded because I have a business in Knox County, and I've been privileged to be a part of this group for a number of years, so thanks to my colleagues for including me in this. Not necessarily my most important bill, but my first bill that we'll come out with will be an opportunity for residents inside the state who have estates or farms that are settled and have a discontented member of the heirs. We're going to try to have a statute put in place that will clear up some confusion in how those are handled as estates are settled, to where families can be much more harmoniously dealt with, and particularly siblings. So that will be our first bill out probably next week.
Thank you. I'm Martin Daniel. I represent District 18, which encompasses West Hills, Dean Hill, Rocky Hill, Cedar Bluff, Ridgedale, and Pleasant Ridge. I serve on the Civil Justice and the State Government Committees. I tend to focus a lot on reducing the size of government and eliminating and reducing regulations so that it's easier for people to live and businesses to open up and prosper. More specifically, I do have a bill this year that would clarify the nature of conflicts of interest among governing boards for higher education. The University of Tennessee Conflict of Interest statute is almost 100 years old and is very vague, and likewise other conflict of interest statutes and provisions are very vague, so I'll be working on that with Representative Brooks.
All right, thank you so much, and thank you for keeping it short. So I'd like to go ahead and kick off with my own question then. Yesterday, Kentucky became the first state to receive federal approval to mandate certain Medicaid recipients to engage in employment activities. And the state now also can charge monthly premiums. On Thursday, Speaker of the House Beth Harwell and Representative Dan Howell filed legislation to essentially pave the way for something similar to take place in Tennessee with regard to TennCare enrollees. So I'd like to hear your thoughts, your position perhaps, regarding this particular legislation.
Dr. Briggs.
There's a doctor in the house.
I was on the TriStar Health Force that we had, not this summer, but last summer, that was appointed to look at the Medicaid expansion and could we do something by filing a waiver with CMS. And I actually traveled to Washington to look at that. And we looked at several of the other states that had received waivers. At that time, the CMS folks that were dealing with the waivers told us that there wasn't going to be a work requirement. And I believe that Representative Kane was at that same meeting that was there. And one of the things that we had proposed, rather than a straight work requirement, would be that they would all receive counseling either on additional education that could lead to work or what some opportunities would be. Now, some of that has changed. I think that many of us, or maybe all of us, would like to have able-bodied people work, but there has to be work for them and they have to have the education to do it. And I think that's a good thing. However, what I don't want to do, and it gets back to a little bit to what Representative Daniel said, I don't want to create a whole new bureaucracy at the state level to try to administer this, is where the cost of the administration and the cost of the bureaucracy is greater than the benefit that the state would receive, at least from a financial point of view. So before I would say, just as a general statement, I would say yes, I do approve work requirements, but I don't want to be, cutting off your nose to spite your face if this is going to end up costing the state more. So the bottom line is I think we have to look at that whole issue as to whether it would be financially beneficial or whether it would actually work. Sometimes we can watch these other states do it before we implement a program like that. But I just don't want to jump into something and then find out that it costs more and we've hired more people to administer it than actually we can find work for them. Did I jump around that well enough for everybody?
Would anybody else like to comment on that?
I haven't seen the legislation yet, so, we're talking in general terms as opposed to specific, but I know in a number of cases when they've talked about this, it is able-bodied people, it is either work or volunteer work or actively seeking work where there is proof that they're, out there actually working to work. And being serious about it instead of going into a business and just saying, would you check this off? They don't really want to work there. So I think there will be some parameters. There's also, I know when it's been talked about before, we have several counties that are exempt from that because of their unemployment rate is still too high. But when your unemployment rate is right at 3%, which is the lowest it's been in, I think, almost forever, but for at least a very long period of time. But there are jobs out there that if people really want to work, they can work. And so welfare is really supposed to be a safety net. And, it really is supposed to be when people can't work for some reason or another. So, as a general rule, I believe in encouraging people to work. But we do need to look at the details of the bill when we get it.
And in looking at the news article this morning in the Knox News Sentinel, the reason Kentucky's doing this is even though they did the expansion with Medicaid, and even though the federal government does pick up the majority of the cost, the state portion is created, it's become unstable, was the wording used in the article. So, and these are not going to be people who are medically not capable of working. There will be exemptions for them, as there always are. But these are, as we mentioned, able-bodied people. You know, there were some changes in the rules back in 2008 and 2009 when the unemployment rate went through the roof to allow more people on the program. I think this is just reviewing. You know, I honestly believe every law, whether it's state or federal, needs almost a sunset provision where you go back and you analyze, is the goal that we started at where we're at today? And I think this may be, although not officially a sunset, it's a review. And let's just see if we're still where we think we need to be, because some of our counties are really struggling to get people to show up for jobs because the unemployment rate is that low.
Now, admittedly, I haven't, other than this morning in an article, seen a piece of legislation, but oftentimes for me, legislation like that creates more questions. One, you want to require people to work in order to receive insurance, but you will not support Medicaid expansion for the working class poor. That's kind of an ironic twist. Secondly, you want less government, but you want to create more government, regulating and finding out and judging and trying to measure who is considered an able-bodied individual. Then you don't want to support measures at the state level to help youth get job training so they can enter the workforce. So there's a lot of little things there that if you want to do that, think about the small nuances and how we're not passing things to create a working class to recruit not just jobs, but good paying jobs. And those men and women that go to work every day, they cannot afford insurance, and they're working, they're paying their taxes. These are good Tennesseans, good citizens of our state, but we won't expand Medicaid to assist them. So for me, I'm interested in seeing this and hopefully having some of these questions addressed as we move forward throughout the session.
Thank you so much. So we'll turn now to the audience questions. The first one, recently $50 million was added to the Basic Education Plan, BEP, which is great, but the fund is still almost $500 million short. Do you favor increasing the BEP? If so, by how much?
I'm sorry, did you say 50 million was added to the BEP? Is that what the question?
Recently, 50 million was added, but I don't know if that is.
Because we added a lot more last year to the BEP than 50 million.
Okay, so the question basically is, do you favor increasing the BEP? If so, by how much?
Well,
It's still almost at 500 million.
when everybody talks about fully funding the BEP, what they're talking about is BEP 2.0. A couple of years ago, we moved away from BEP 2.0 to BEP 1.5. The reason we did that, had we not made that move, Knox County would have received less money than what we're receiving right now. If we had stayed with BEP 2.0, Knox County would have gotten less money through the BEP. So we made a change. But at the same time, since Governor Haslam became governor, we've put $1.3 billion into K through 12 education. You look 2011 and go back 18 years to 1992, the state put $1.8 billion. So in 20 years, 1.8, in 7 years we put 1.3. We still have a lot to do. I think you'll see proposals this year around putting the RTI as a funded component of the BEP, the natural growth of the BEP. I think it's going to be around $50 million. But I think you'll also see at the state of the state, the governor continue to push and will support, additional pay for teachers. So you're going to see some additional money go into the BEP, but just kind of know where we are and where we've come in the last few years. Bill.
I'd just like to say, obviously you've got to have money to run our schools, and it does make a difference. But policy is so important, and a lot of times that gets lost. A lot of times we say, let's just spend more money. But I think with that, you have to say, what are we spending it on? Tennessee right now is the educational envy of the United States. We are the fastest improving. Other states are coming to Tennessee to say, what are you doing? And a lot of it deals with policy. they don't come down and say, oh, you're spending 1.8 or 1.7 billion more. They want to see the policy we do, the evaluations, the training, whether it's teachers or principals. And so we need to always look at policy. And we also need to look at things in education that may not be working the way we thought they would. And I know at this forum before I've brought up the Tennessee pre-K program, to which we have a Vanderbilt study that says that the children who attend our Tennessee pre-K program actually do worse. It doesn't just fade, it does worse. And thankfully, the Department of Education is taking that report seriously, and in discussions, they're trying to make a difference with that. I actually have a bill, and it makes so much sense it probably won't go anywhere, but we're spending $85 to $90 million on pre-K. And the idea would be, the state's always asking Washington, D.C., please send us the money as block grants, and we'll figure out the most effective way to achieve these goals. I think in a bipartisan way, we can all agree that children should be able to read at grade level by grade 3. It'll make a huge difference. So my bill would say, with this money we're sending back to the different counties, we're going to send it as a block grant with the idea of helping these young children obtain reading. And so if the LEA, the local education agency, if they want to keep, if they like their pre-K, they can keep their pre-K. I know that sounds like a former president, but it really, they could keep it. But they may want to take the money and say, you know what, if we get reading instructors, that would be better. They may want to say, instead of having 180 days of pre-K, and then you take the summer off and then have the kids come back after they've lost what they learned in pre-K, we may want to do a summer program. In fact, this week I ran into someone who had heard me talk about these, and the school system he's working with is actually going to try that idea of pre-K being a summer program right before kindergarten, as opposed to a program where they take the summer off and probably everything fades. So I'm sorry for being a little long-winded, but my main point is educational policy has got to be taken into account more so than just the spending part.
And then just a quick comment regarding education in general. We can't overlook the fact that, as Bill said, we are the fastest improving state in the nation. And I think those of us in East Tennessee, especially in Knox County, we can take a little bit of pride in that, because just at this table we have Chairman Roger Kane, Chairman of Education Sub, Vice Chairman Eddie Smith, Jimmy Matlock's on education, and then Bill Dunn's on education, and then Harry Brooks is Chair of Education. So when you look at the success of the state, those of us in Knox County, we can take up some pride in the fact that we have been an integral part of that success. Part of that is the leadership you have right up here along with Chairman Brooks. So that's a big deal. I don't think we need to overlook that.
Thank you. The next question, what is your position on expanding gun carry legislation to students at public universities and colleges? Current law allows full-time staff to carry if they have permits and have notified the campus police. So this goes back to Representative Daniels' efforts.
Thank you. As you know, we expanded gun rights a couple of years ago or last year, enabling faculty and staff of higher education who have carry permits to possess and carry on college campuses. I think that's a good step. I think it's wise in the event you have a shooter situation. They can offer protection. I think that's adequate, and I think I polled the people in my district, and they oppose expansion of that to college students. So I would abide by their wishes and oppose any attempt to expand that carry right to college students.
Would anybody else like to give their thoughts on this? No? So we have a couple of questions that's actually directed to specific individuals on this panel. So the first one is to Senator Becky Duncan Massey. You claimed last week that the phasing out of Tennessee's inheritance tax effectively paid for itself by attracting people to Tennessee. Do you have any support for this assertion?
Well, I talked about actually one specifically the inheritance tax, but basically by reducing taxes, it encourages growth. It encourages people to move to Tennessee. I believe that strongly that our environment here, our low tax rate, we are the lowest net per capita state in the country, and I believe that all of that was instrumental in getting the Discovery Channel to come and announce this week that they are moving to Tennessee. And they are definitely not wanting to go to a state where there's high taxes. So it's going to be good jobs, and actually I was worried, I was thrilled when I found out that they weren't going to be taking jobs away from us with them basically buying out Scripps Network. So I'll stand by that, and there are reports that I've read. I don't have the exact titles in front of me, but it does promote growth.
And I would add to what Senator Massey just said. In our area, Representative Zachary and I, he resides in where I work a lot. Housing starts, new growth are going at an incredible rate. In Loudoun County, in Telco Village, in the last 14 months, we have 900 new home permits. These are retirees who are moving to this region, the greater Knoxville area, almost exclusively because of our quality of life issues and our low taxes. There is no question that the entire mood that we've had over the last 5 years in the General Assembly, which is to make people want to come to our area, is proven out to be exactly what they are now doing. So I think what Senator Massey said is exactly spot on, and there is data that will substantiate that. We can see it all over and everywhere inside of our area. There's growth in every section of this county and throughout the region.
I want to comment also, and this has to do with the Improve Act that we had last year that was very controversial. Part of that Improve Act was that we decreased the F&E tax. The year before that, we lost a manufacturing out of West Tennessee, one of the car manufacturers, this would be equivalent to the Volkswagen place, left and went to, they went across the border down into Mississippi because their F&E tax was a lot lower. I was standing with Senator Yeager in front of an elevator. This was the day after, the afternoon that we passed that, and the F&E tax was going down. He got a telephone call, and if you know Dr. Yeager, if you know Senator Yeager, he's a little guy. He jumped up and clicked his heels, if you can imagine. And it was that there's a Finnish tire company that's coming to Ray County that's going to bring very high-paying jobs. Within 48 hours of us cutting that tax, we had 2 major industries that were coming with at least $500 million in capital to build places, and they were all hiring more than 500 people, and many of those jobs, counting the benefits, are going to be over $25 an hour. Some of them substantially over that, the average job. And we had another major manufacturer that, rather than leaving the state, expanded, closed places elsewhere, and moved in the state. So these taxes do make a difference. I'm just sorry we didn't do it a year before and get a major car manufacturer out in West Tennessee, where truthfully the economy is struggling more than it is in Middle Tennessee and East Tennessee.
The next question is directed to Representative Daniel. Some people use regulation as though it's an evil idea, but regulation has given us clean air, clean water, and safer environments for workers. These regulations might have cost business more, but they have also saved countless lives. How do you balance the public welfare with possible cost to business?
Well, that's what we're for. That's what the legislature is for, to balance the needs of regulations versus excessive regulations and the need for persons and businesses to expand and operate. So we have to take a look. We need to have more oversight of the regulatory process. I have some bills that will do that will provide the legislature more oversight of bureaucrats and regulations. So the power to make those decisions, the authority to make those decisions will return to the people. and not be left with bureaucrats and faceless administrators.
Thank you.
I think to add to what Representative Daniels said, we have seen in the national situation in the last 12 months, when our nation decided finally to get out of the regulation overreach that we've had going for years and years, our economy has blossomed. And then one more thing in addition to what was one more thing that was said in addition to the previous comment, we also, in the federal level, in the last 90 days, have decreased the business tax. And we have seen over the last few days what that means to the average American. Job increases, bonuses, extra money on the hour. We're already doing that in Tennessee. It's great to see the federal government finally do what Mark's been advocating for a long time, and that is to allow people, not bureaucrats, as he said, to finally get in charge. And there is a balance between doing the right things, the clean air, the protection of our resources. But if our country blossoms as it appears it is economically, it's going to be because of low taxes and limited regulation. And I think that pathway that we're on, we've already been doing it in Tennessee, and the results we can see here are pretty obvious.
One thing that I want to add that we actually have been doing for quite some time, and it actually is a really good process. We have a government operations committee, and any department that has that wants to put in new regulations in place, they have to submit it to the government operations committee. They have to hold public hearings. And whether it's pro or con, whether people are wondering if it is for the public good or not for the public good, or if it's onerous or if it's not, or if it's needed, you know, all parties can come and testify in their public hearing, and then when it's before the government operations, they could also come and testify. And it helps that regulations are not just thrown at the books willy-nilly, but there is a thought process and a review process by the elected representatives to make sure that that it is needed. Granted, most of the regulations that are proposed have to do with legislation that was passed, and they have to have regulations to go along with it to implement it. So, you know, most of them aren't challenged as a rule, but there is a process, and there are definitely times that they are challenged, and they push back about the department to go back and look at it and see if that is the best way to accomplish this. So I actually am real proud of our Government Operations Committee to really be thoughtful in the process of the regulations that are put in place that affect each and every one of us here in this room.
And I think so many times people will give us a concrete example. We've got a great one from last year in the House. Last year I carried a bill related to TDEC's rules that they were issuing for stormwater retention. Most people don't think anything about stormwater retention, but TDEC had been issuing these rules without us, your representatives, having any say in the process, and development costs had gone. In 2010, they were $280 per square foot. They had jumped up to $580 per square foot. And these rules were being set, not in front of us, as Senator Massey mentioned, in the Government Ops Committee, without any approval or oversight from us. These rules were being issued. So we passed a bill last year that simply said rules and regulations are fine, but so you have a say in the process moving forward, you have to come before us before you issue those rules that have such an economic impact on our area. Those have to come before us. So that is a perfect example. The EPA, you'll love this, the EPA came in last year and said, Tennessee, your standards are above what even we recommend. And that's a concrete example. And so, in turn, we then reduce those, and so now we are where we are, and we're winning. So most people want a concrete example. That's a perfect one for last year, from last year.
Thank you. This is a follow-up question. It's related to what was just discussed. Low taxes increase growth, yet increased growth puts stress on the school system, the road system, infrastructure, fire and police protection, all of which is paid for by taxes. Can you speak to this?
Can you repeat that question, please?
Sure. So, low taxes increase growth. Representative Daniel, you talked about the growth and all. Low taxes increase growth, yet increased growth puts stress on the school system, the road system, infrastructure, fire and police protection, all of which is paid for by taxes. Can you speak to this?
I'll take a shot at this one. You know, one of the things that we've tried to do, Senator Massey mentioned it, and then Representative Matlock brought it up too, making ourselves a low-tax state is attracting people like at Tellico Village. You have 900 houses going in. Most of these houses will be for people who are retirees. They're moving here because of our friendly tax base. They pay taxes while they're here, and yet they don't use the services like our public schools. You know, we just had the gas tax issue that went through. We're trying to fund that. We're being rather laser-sighted at trying, like tourism. We will always like to spend money on tourism. Those people come, they stay in our hotels, they eat our food, and they leave. They don't tax our resources here in the state other than our roads. And so we're making sure our roads are funded well. You know, and like I said, if we're attracting people who are retiring here, then they are providing taxes to our state without putting undue burden on our public school system.
Now, the way I interpreted that question, is it okay to, is basically the way I understood that we're having more people come to the state that's putting a burden on the logistics of that growth. Are we able to handle the increase of students in a school and more people on the roads? Is that correct? I want to make sure that I understood that question.
Is that correct?
Basically, okay, so using Atlanta for an example, they may throw up a 100-unit apartment complex, and then an off-ramp by that complex is taking 100 more cars. They're oftentimes in development making decisions without thinking about the increased offload or onload onto the roads. Also, the size of classrooms. They're not thinking about you about to get 100 more students in this classroom. So when we make decisions to do that, even Knoxville is going through a quiet boom. But as we move forward, we can't make 5-year decisions. We have to have a broader plan and think 20 years down the road as we are becoming a more attractive state. I think Murfreesboro has 250,000 more people in it. We have to make sure that our infrastructure is set for that we don't have jam-packed situations, that we don't go from a classroom of 20 kids to 35 kids and it's more stress on the teacher. So as a lot of those issues that are in that question, and of course I leave it to my colleagues to address, will fall back on the local bodies, your county commission and city council, to help try to expand the roads, look at increasing classrooms, and of course for the state level, because we're adjusting and helping with those taxes and some of those policies, we would help in any way to funnel funding to assist with that growth. Because once again, Tennessee is the best state to live in. We may argue sometimes, but we have the most beautiful countryside, we have some of the most friendly people, and I think we just have overall a healthy environment. But if I was wrong in answering it, please forgive me, but that's what I interpreted from that question.
And actually the person who wrote the question confirmed your interpretation.
Okay.
That's good.
And if I could just say something, because so much of government comes down to money, resources, and we talk about taxes and how much money we have. It's very important. You already pointed out that Tennessee is the educational envy of the United States. It's also, when it comes down to budgeting and financial, many states are envious of us. We have a AAA bond rating. The past 2 years, and I don't think it's ever been done in the history of the state, we added no debt to the citizens of Tennessee. And the reason that's important is because then when you do have challenges that deal with money, you're dealing with them from a very strong position. You can just think personally, if somebody's really in debt and they're maxed out on their credit cards and then an emergency happens, it's a lot harder to react. But because Tennessee, and this was true when the Democrats were in charge, it's even more true now that the Republicans are there, but I do give credit that the state of Tennessee has always taken it seriously to say, let's make sure our pensions are funded, keep the debt extremely low. And so that's something else I think the people of Tennessee should be very proud of.
And I want to add, there's two ways in government that you can get more taxes. One, you can tax your people more, or you can grow your tax base. What we've done over the last few years as we've cut these taxes is we've been growing the tax base. So our people have to pay less in taxes, but we have more people paying taxes. And what we did last year with the Improve Act, we cut out 1% of the grocery tax only on the state level. So the state is receiving less money, not the locals. But if you look at those numbers, we need 250,000 families to move into Tennessee to recoup the amount of money we cut. Over the next 15 years, they're anticipating the state will pick up 2 million residents. So over the next 15 years, we're going to recoup what we cut in the grocery tax, both on the state level, but at the same time, since we didn't cut the local level, a big chunk of the sales tax money goes to schools. In the city of Knoxville, 75% of the sales tax dollars go back to the county for the schools. And one of the bills that Representative Zachary and I believe Dr. Briggs has is looking at, on the state level, again, trying to reduce the size of state government, get it back to locals, is returning the 1 1/8% of the administrative fee. So all the taxes are collected, it goes to Nashville. F&A keeps 1 1/8% of an administrative fee before those sales taxes come back to our communities. For the city of Knoxville, that's $1.7 million that the city is not getting. It's $525,000 for Knox County. It's $150,000 for the town of Farragut. That's over $2 million that isn't coming back home and staying in Nashville that we're all supporting and working to try and turn around to get back to our local communities.
Next question. Representative Matlock issued a press release earlier this week stating that he will file a bill to defund Planned Parenthood. Without knowing the specifics of this bill defunding, Planned Parenthood will likely mean blocking Medicaid patients from seeing the provider of their choice for preventative health care services. Could you speak to how imposing government regulations on who a person can see for medical care is consistent with the goal of smaller government and less government influence?
Thank you.
Interference. Rather.
Thank you for the question. The bill has not been yet filed. We're working on the language to get it just the posture that it needs to be. Our goal here is to take away no services. Their services are already provided in every county. There are three Planned Parenthood locations in our state. They're misrepresenting the facts. The things that they offer there are available at so many other places. What we do know is offered there, tragically, is the taking of lives. And I find, and my district finds that repulsive. And the taxpayers of this state find that repulsive. And the intent of this legislation is not to prohibit services. It is to simply say that the citizens of this state do not want and will not stand for their dollars going to pay for a process that many of us in this room, and certainly lots of people across the state, find absolutely deplorable.
Would anybody else like to comment? The question here is, the problem is the cost of health care. Insurance is one of the causes of high cost health care. What is being done to reduce the cost of care?
Many of those decisions are being handled way above our pay grade here. I mean, that's a national issue. That's just not a local issue. One of the things that I think the public, and I was talking with a gentleman before we started the meeting on this, is within TennCare, which is the largest part of the budget. You know, we talk a lot about education, but the TennCare budget is larger than the education budget. The medical inflation is less than 4%. As many of you know, particularly if you're a small businessman, the inflation that you're seeing in your premiums is anywhere between 15 and 25% a year. If you look at the healthcare marketplace, the insurance exchanges that were part of the Affordable Care Act, even the insurance agencies had approved premiums going up as much as 62%, and I think the lowest we had when we still had 3 providers was in the 40%. So I think the fact that we're holding, at least for the Medicaid program, the TennCare program in Tennessee, under 4% is pretty remarkable. Again, what to do about this on the national level? Much of it has to do with the cost of medications, and we can talk about keeping health care down by having people lose weight, eat healthy, exercise more, and those things, because that definitely keeps it down. And there's some things we are doing at the state level on that, but there still isn't too much that we can do because much of this is controlled at the national level.
And I want to add one thing. If you look at, you mentioned the education budget. If you take K through 12 and all of higher ed, it's still less than the TennCare budget. This year we're going to have less available dollars than what we typically do. And we can't, none of us can sit here and say what Washington's going to do right now, but there's one area that I think all of us are concerned about that we've got it funded through the end of June that we may have to look at as we go through session about putting money in on the state level and funding, and that's to keep our CHIP program going.
Richard and I did go up to Washington, D.C., and we did visit with CMS after Insure Tennessee was defeated, because we wanted, as legislators, to come up with a workable solution that was good for this state. CMS was pretty ornery. They don't listen very well. So we came back without a situation. The Affordable Health Care Act, like I mentioned earlier, is like all good legislation. It needs to go back and be reassessed every couple of years to see if it needs to be tweaked. One thing you may not realize is I, at 54, pay the exact same rate as a 54-year-old man who's had cancer 5 times, who weighs 890 pounds. We pay the same premium. We took away all discriminating factors out of healthcare. The only thing that makes a difference now in your premium is if I were to smoke, I would pay more than not. There are no incentives to try to get better, to try to get your blood pressure under control, to try to lose weight. And maybe we need to go back and revisit the Affordable Health Care Act and give people some incentives to try to live healthier lives. I mean, when we went up to CMS, they told us that we expected healthcare costs to go up 25% a year. That's incredible, because I don't know if your paycheck goes up 25% a year, and then we got 41 and 62. And, I mean, I used to sell health insurance as an insurance agent. We stopped selling it. First of all, they didn't pay us anything to do it anymore, because now you have navigators, which are unlicensed people sitting in a call center somewhere helping you. But on top of it, you couldn't resell this. I can't have a customer come in and say, well, your premium was $1,000 last year. This year it's $1,600. And now, by the way, one of the leading causes of financial distress in households is the $5,600 deductible. You go to the hospital, nobody has $5,600 laying around. And even though the cost keeps spiraling out of control, there's no real drive to make healthcare truly affordable to the average consumer, because they don't have the $5,600 deductible, and it's leading to medical bankruptcy in households today.
But I don't have $56 million for everybody. It's just at the house. So whatever money I have, Letitia doesn't let me know. So this is the thing. Under the previous administration, and I agree with my colleague, Chairman King, there should be some incentives for people when it comes to health care. But under the previous administration at the national level, when that was brought up, it was kicked back because they said the government was trying to regulate people's lives. But then at the same turn, we kind of still want to regulate how women and what they do with their bodies. So we can't have it both ways. We have to start thinking about a constituency and what's affecting people every single day. We have to figure out a way.
That's a lie.
And one thing about it, I try my best not to make sure I lie, because I think that's a sin, but we'll go to that. We'll go through that another thing. And please, if you have a response, write it on a card so I can respond to it accordingly. Thank you. Now, having said that and responded to that, We have constituencies and individuals every day who are suffering because they don't have health care, or they're suffering because they can't afford to feed their families. Our decisions should be made with that in mind, and that goes across the aisle. One thing I can say about this delegation is that we think about Knoxville first, and we are, like some of the other delegations at state level, are able to have conversations instead of strong heated debates. We can debate about something, but I think we can come to a concurrence on the thing that works best for the people. But tensions get high and people stop listening. And when you stop listening to people, you can't hear what they're saying. If you can hear where an individual is, you can find a common ground to do what we're supposed to do in the first place, which is get something done. And if we get caught up into the bickering, the hostility, we'll never be able to move forward. While we're not moving forward, people's lives are at stake, and we're losing more than we're gaining. So what I would ask is, please keep that in mind and kind of understand that we all have concerns, we all have care, we all want to see Tennessee grow, we all want to take care of our families, but we have to do more listening to one another to try to see how we can get that done together and not separate.
Right, thank you. We only have 5 minutes left. Just very quick.
Real quick comment. It's also important to remember too, last year we did take steps to provide health care to those who maybe couldn't afford it, provide a better quality of health care when we defined and put parameters around direct primary care. Trinity Medical opened a facility here in Knox County. They've got one in Maryland. If you're not familiar with direct primary care, you basically pay $60 a person with a cap on your family. So a family of 4 would pay $240 a month. All their services are covered by a general practitioner. You go to that office, he sees a smaller pool of patients. It provides a higher quality of care. So many times do we focus on cost without focusing on quality of care. And so we did take steps, and I believe everyone here on this panel voted for that bill last year. And so in Tennessee, we are taking steps. And as Dr. Briggs mentioned, the reality is we're just handcuffed by Washington to a certain extent. So to say we've done nothing is not accurate. We have taken steps, and we did that even last year to try to get outside the box to provide a solution. And most people don't realize the team at Trinity Medical with direct primary care, they'll see veterans for free, they'll see the homeless for free. So many times we like to focus on a problem, but when we provide solutions, no one talks about the solutions. The solutions are out there. If you were in Knox County, if you were in Maryville, you don't have to go to the emergency room. There are now direct primary care clinics that provide an excellent quality of care, and that bill we passed last year ensured the viability of those clinics.
That wasn't exactly short, Representative Zachary.
That was short for me.
Was that short for you? Okay.
Yeah, believe me, it was.
We have maybe time for one more question. What is the status of the medical cannabis issue in the state legislature this year? We might be able to squeeze in one more.
The status is that Representative Faison and Senator Dickerson's from Nashville. We had a task force that worked on this summer. We had a total of 3 meetings, and they were pretty much all day long meetings. We had experts that were flown in from really from all over the country to testify, and I anticipate that those bills will be filed, and so that's the status of it.
I'm on the health committee also, so it'll be there, but I did meet with the folks last week. I believe it is in oil form only, and I believe that's what the proposal is going to come out, and it's going to have very tight restrictions on it. Now, it's still got an uphill battle to pass, but they have structured it so it is a very tight bill, and so it doesn't allow for the smoking of marijuana, medically or non-medically or whatever. So I think that's the status of it at this point.
Thank you. I think we have time. I'm going to squeeze in one more, and it is a long question, so I'm just going to edit it down. First, this is from the person who wrote the question. First, I would like to thank the General Assembly for mandating that all entries subject to the Tennessee Public Records Act adopt a public records policy that has been beneficial to both the offices and to the citizens. The TPRA specifies that citizens can insert public records and can copy those records subject to reasonable rules. Some offices interpret reasonable rules to allow an absolute ban on allowing citizens to use camera phones or handheld scanners to copy records. Would you support allowing citizens to photograph records rather than laboriously copying them by hand or paying copying and labor fees?
Short answer, yes.
Okay, well, that was a really easy one, and I think we're out of time, so if you would join me in thanking the panelists.
Before we go, when you look up here, the easiest way to get us is email us or call us. All of our numbers are listed on the capital.tn.gov website. Most of us spend when we're in Nashville after hours just returning emails and phone calls. I've sent out a survey. I know Representative Dunn sent out a survey, and we've been working through calling back constituents. So stay in contact with us as we go through session, because last year there were 1,400 bills filed. None of us can be experts on every one of those bills, but so you may find something that comes up that we haven't yet seen. So be sure and just communicate with us as we go through session.
Thank you very much. Hope you enjoyed your lunch and discussion today. Thank you.